Hello everyone, this is Neelima. Today I would like to discuss about the topic diuretic drugs. What are diuretics? A diuretic is defined as a drug that increases the rate of urine formation. It not only increases the rate of urine formation but also helps in the rate of urine excretion and are used to adjust the volume or composition of body fluids in a variety of clinical situations including hypertension, heart failure, renal failure, nephrotic syndrome and cirrhosis. The primary action of most diuretics is the direct inhibition of sodium reabsorption. So most of the diuretics act by inhibition of sodium reabsorption at one or more of the four major sites along the nephron. An increase in sodium excretion is accompanied by increased excretion of anion like chloride ion. Diuretics reduce extracellular fluid volume by decreasing total body sodium chloride content. So this is the diagram of a nephron. So there are four major sites along the nephron that are responsible for reabsorption. Site 1 is a proximal convoluted tubule. So you can see here, this is a proximal convoluted tubule. Site 2 is the ascending loop of Henle. So this is the site 2, ascending loop of Henle. Site 3 is distal convoluted tubule. So this is a distal convoluted tubule, and site 4 is late distal tubule and collecting duct. So this is site 4. So now classification of diuretics. So if we see the classification of diuretics, these drugs are divided into four classes. Site 1 diuretics are carbonic anhydrase inhibitors. Examples: acetazolamide, midazolamide, dichlorphenamide, chloraminophenamide. Site 2 diuretics are loop diuretics, also known as high ceiling diuretics. Examples: furosemide, bumetanide and ethacrynic acid. Site 3 diuretics are thiazides. Example: chlorothiazide, benzthiazide, hydrochlorothiazide, hydroflumethiazide, bendroflumethiazide. And site 4 diuretics are potassium sparing diuretics. So under this category we have two subtypes: sodium channel inhibitors, example triamterene, amiloride, and aldosterone antagonists, example spironolactone. So this is about site 1 diuretics, which are carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors are derived from the sulfonamide antibacterials. The carbonic anhydrase inhibitors have an unsubstituted sulfoamyl group in their structure, And these carbonic anhydrase inhibitors may have a heterocyclic ring, and some drugs may have benzene ring attached to sulfomoyl group. Accordingly, carbonic anhydrase inhibitors are divided into two groups: simple heterocyclic sulfonamides, meta-disulfomoyl benzene derivatives. So this is the mechanism of action of carbonic anhydrase inhibitors. So this carbonic anhydrase is an enzyme found in various segments of the nephron, especially in the cells of the proximal convoluted tubule. So this carbonic anhydrase enzyme catalyze the reversible reaction of H2O plus CO2, giving rise to H2CO3, that is carbonic acid. So this carbonic acid, which is formed, spontaneously ionizes into H plus and HCO3 minus ions. So the H plus ions which are formed are exchanged for sodium ions. So now our category of drugs will be acting or inhibiting carbonic anhydrase enzyme. As a result, this reaction will be slowed down. That is, the hydration of carbon dioxide will be slowed down. As a result, there will be decreased availability of H plus ions to exchange with sodium ions, leading to urinary excretion of sodium ions, potassium ions, and bicarbonate ions. So this is a mechanism of action of carbonic anhydrase inhibitors. So what are the adverse effects of this category of drugs? These drugs produce metabolic acidosis, hypokalemia, that is decreased potassium, decreased glomerular filtration rate, and hypersensitivity reactions. So the major use of this category of drugs is in the treatment of glaucoma, because it reduces the rate of formation of aqueous humor, thereby reducing the intraocular pressure. So these are the SAR studies involving simple heterocyclic sulfonamides, and this is a structure of acetazolamide, which is an important compound of this group of drugs, that is carbonic anhydrase inhibitors. So the first point is the sulfomoyl group. So this is a sulfomoyl group is essential for the drug to show its activity. Second point is the sulfomoyl nitrogen. This is a sulfomoyl nitrogen must be unsubstituted, because mono and disubstituted compounds are found to be pharmacologically inactive. Third point is substitution of a methyl group on one of the ring nitrogen. So here we can see substitution of a methyl group on the ring nitrogen retains carbonic anhydrase inhibitory activity. Example, methazolamide. Fourth point is the moiety to which the sulfomoyl group is attached must possess aromatic character. What is the meaning? The sulfomoyl group must be attached to an aromatic moiety. So these are the SAR studies involving meta-disulfomoyl benzenes. So the first point is the parent 1,3-disulfomoyl benzene. So this is the parent nucleus, that is 1,3-disulfomoyl benzene is inactive, but substituted analogues. So if there are any substituents on the ring, then the drugs will be showing diuretic activity. Second point is maximum diuretic activity is observed when the position 4, so this is position 4, is substituted with chlorine, bromine, CF3 or NO2. Here 3 and 2 must be in subscript positions. Third point is an unsubstituted sulfomoyl moiety. So the sulfomoyl moiety should be unsubstituted at position 3. And this is essential for activity. So the drug structure should contain unsubstituted sulfomoyl moiety in order to show activity. Fourth point is replacement of the sulfomoyl moiety at position 1. So this is a sulfomoyl moiety at position 1. If we replace this sulfomoyl moiety with an electrophilic group like carboxylic group, then it will result in decreased carbonic anhydrase inhibitory activity. So next group is about site 2 diuretics, that is called as loop diuretics or high ceiling diuretics. Diuretics, so this category of diuretics produce peak diuresis, meaning this category of drugs produce maximum diuretic effect than other diuretics and act at the loop of Henle. So that is why this category of diuretics are called loop diuretics, because their site of action is at loop of Henle. And these diuretics are also called high ceiling diuretics. There are 3 major classes of loop diuretics. Organic mercurials, example chlormerodrin, mercury, mercaptomerin, etc. Sulfonamide derivatives such as furosemide, bumetanide, etc. And the third category we have non-sulfonamide derivatives. So this is a mechanism of action of loop diuretics. Loop diuretics inhibit the sodium potassium chloride symporter. So here the meaning of symporter is a co-transport mechanism. So these loop diuretics will be inhibiting the transport process of these ions in the ascending limb of the loop of Henle and thereby exert a powerful natriuretic effect. That is, this loop diuretics will cause increased excretion of sodium ions. And these diuretics are sometimes called high ceiling diuretics because they produce a dose dependent diuresis throughout their clinical dosage range.